coronary artery CT scan is basically an X-ray test where you look at the coronary arteries and you can assess whether or not there's any luminal narrowing, the diameter of the lumen, if it's narrowed or blockages are there. It's important to look at the coronary arteries because these are the vessels that give oxygen to your heart. The muscle that beats and keeps everything flowing needs oxygen and needs its own blood supply. So if there's a blockage in those coronary arteries, you get a heart attack, right? You have no oxygen getting to the heart muscle and you have a heart attack. That's what a heart attack is. In the past, we were only able to look at the actual structure of those plaques and see how bad is that narrowing. Is it minimal or is it moderate or severe? Now, when we look at the heart flow piece, we actually can tell the patient whether or not that narrowing is actually functionally significant. Is that going to really result in a heart attack? How bad is that blockage, and is it going to result in symptoms per se? Or is that functionally going to affect the ability of that vessel to supply oxygen to your heart? The typical patient is a relatively young patient between the age of 40 to 60 who has low risk and comes in and has, I have a chest pain that won't go away, and they've done all tests and they can't seem to figure out what the reason is, and so they come in and they look at their coronary arteries with a CT. Nowadays, actually, we have multiple other etiologies or causes which can cause chest pain, and we also can look at those individuals case by case. And so I work with cardiologists and we try to figure out which test is the best test. But classically, for a patient with low to intermediate risk, they are they're your typical patient coming in for a coronary CTA. The plaque that you have building up in that vessel, causing narrowing, can look like it's intermediate. It doesn't look very severe, and you say, okay, this is intermediate or moderate narrowing, but you don't really know whether or not that's significant, whether that's going to result in a functional abnormality. When you add the FFR piece, you're actually going to give the doctor more information that's guiding them, because it will either result in the patient needing to go get a stent to open up that vessel, or they're just going to manage the patient medically, give medicine, treat that with a statin or some other lipid lowering drugs. So it's really guiding management, and it's also going to help for those cases where this narrowing is severe. It's going to help target that intervention. So when they go in for a cardiac cath, they will know exactly where to go, where to put the stent, and the technology is so advanced right now that you can actually do pre-cath planning, and you can put a stent in there and kind of see how that will change the flow within that vessel. And it's all done before you've even been in the cath lab. So it really is guiding management. It's helping the cardiologist know where to go. It's like a little roadmap for them. And ultimately, what we think is it sends the right patient to the cath lab. It helps the surgeons and the cardiologists know where to go. And so it'll decrease the time in the cath lab, which is great. It will eliminate unnecessary cardiac cath, which is an invasive procedure with obviously some risks involved. And it's great to be able to put the patients that don't need an invasive procedure in a separate category. Only the ones that need a cath will then go on to cath and have that procedure. So it helps to sort of triage or separate the patient that needs a cath from the ones that do not need a cath. And ultimately, that benefits everybody. A CT study is much less expensive than an invasive cardiac cath. And so in light of how things are with COVID and the pandemic and how hard it is sometimes to even get a patient in the hospital, it's really an added benefit to have this as an option. So you don't go straight to cath nowadays. Now you have an extra test in between, another option to choose so that you can assess the coronary arteries in an outpatient center outside of a hospital and have, more information.